Kerr.
Well, last Thursday, the Minister in charge of this bill reported her total failure to this chamber without a word of apology. 4 committees of this Parliament told her the bill was flawed. Every major stakeholder told her they had no confidence in the bill. £30 million of taxpayers' money squandered. And what made it worse was her unwillingness to accept any ministerial responsibility or to apologise. Presiding Officer, in my professional experience, any employee in any other job, in any other walk of life, would have left the building with their belongings in a cardboard box. But when I put this to the Minister, she told me, and I quote, "To be fair, that is exactly what I would expect from Stephen Kerr. The Conservatives have opposed the change at every turn. By their very nature, they like things to stay the same. That is the essence of Conservatism." Not true. My mother, Minister, my mother had dementia. The carers in the home she was admitted to were exemplary. Truly wonderful people, doing a difficult job with tact, love and good humour. That is why I want to see how we value care and carers changed. In time, my sister and I had to sell the family home we grew up in to fund my mother's care. My wonderfully decent parents always lived modestly. They paid their taxes. They saved. But at the end of the day, every penny they had saved, including their principal asset, their home, the council house they had bought, was needed to pay the bills. My parents wanted to pass something on to their grandchildren to help them with the start of their adult lives. It didn't quite work out like that. And my family is far from unique. We all want our parents to have the dignity they deserve in their senior years, especially when they become dependent on others. The Scottish Conservatives want to end the disparities in choice and quality of social care across Scotland. The SNP say they recognise the need to address these inequalities, but their execution has been disastrous. They wanted, as in so many of their so-called reforms, to take power from local communities to the centre. And here is what COSLA said in 2021. Council leaders together voiced their opposition to the recommendation which proposes the removal of local democratic accountability from adult social care and the centralising of the service under a national care service with accountability falling to ministers, a move they described as being detrimental to the local delivery of social care and its integration with other key community services. That's what COSLA said. The Finance and Public Administration Committee nearly 3 years ago were, and I quote, not confident that the figures presented in the updated FM, Financial Memorandum, and the accompanying shared accountability paper are an accurate reflection of the final costs of the bill. And the STUC General Secretary, not someone that I would normally quote as a Scottish Conservative, said last month, care workers are on their knees trying desperately to cover shifts and visits to those in need. There's a shortage of staff across Scotland, with local councils and employers all struggling to deliver vital social care. Yet the government is ploughing on with the National Care Service Bill, which fails to address fundamental issues about how social care is delivered. The Scottish Government seems hell-bent on repeating the mistakes of the past. The SNP Government has ignored expert advice, prioritising central control. And meanwhile, health and social care partnerships across Scotland are heading towards certain bankruptcy. Presiding Officer, this is a government out of ideas, out of time, and at times, the Minister should listen to this, out of decency. Whoever follows these ministers into office is going to inherit a total shambles from the most incompetent and economically illiterate government that Scotland has ever endured.